Hello, and thanks for joining us. The subject of talking points is one of the most commonly performed procedures in wound care clinics across the United States, wound debridement. Now, we know that wound debridement is critical to the management algorithms guiding the treatment of both acute as well as chronic wounds. Removal of necrotic tissue and tissue barriers to healing, combined with decreased bioburden, removal of senescent cells and inhibitory cytokines, as well as the reinitiation of the acute phase of wound healing, are all cited as being the benefits of performing wound debridement. The clinical benefits of debridement are mirrored by financial positives. Talking Points believes that the additional billing and revenue generated by the debridement procedure codes has resulted in overuse of surgical steel in the wound care clinic. Now, apparently, CMS held similar concern, and findings of 200 to 300 debridements with a frequency of the procedure being performed as often as 3 times weekly for a single patient resulted in OIG investigations. Now, these investigations confirmed the overuse and abuse in some cases, and this has been translated to recent national and local coverage policies limiting the number of debridements per wound in a given patient to a total of 5. The abuse by some may have significant negative implications for many, for both clinicians and patients alike. When it comes to debridement, clinical efficacy should rarely, if ever, be sacrificed because we are not paid for it. Yet this will now become a decision that many clinicians will face. Not performing a needed wound debridement could truly compromise patient healing and place them at risk for non-healing or worse, possibly amputation. Talking Points believes that the solution to this dilemma is to utilize debridement tools and technology that accomplish optimal wound debridement. An aggressive and thorough selective or excisional debridement that is associated with bacterial killing should become the standard of care for all wound care experts. Now, this type of debridement can be accomplished with minimal pain during routine wound care clinic appointments using low-frequency ultrasound. Ultrasonic devices provide a novel option for wound debridement that maximize clinical efficacy while adhering to and staying within the new CMS guidelines. We will discuss this technology in greater detail in this episode of The Wound Wire. Stay tuned. And that's a memo.